Hey, it's Dr. Isom. I want to talk about something that frustrates patients and doctors, and honestly, it should frustrate all of us. Because what we call healthcare in this country is not actually designed for health. It's designed for billing, it's designed for compliance, it's designed for insurance rules. And somehow, in the middle of all that, we expect people to get healthier. That disconnect is the reason I practice medicine the way that I do now. And it's also the reason direct primary care, or otherwise DPC, exists at all. Let me start here. I didn't choose DPC because it's trendy. I didn't choose it because I wanted to be different. I chose it because it allows me to practice medicine the way that I would want to be treated. And once you see how traditional insurance-based medicine actually functions behind the scenes, it becomes very hard to unsee why so many people feel unheard, rushed, confused, and reactive instead of truly cared for. Let's talk about the annual physical. Most people think their annual physical is a time where you talk about how you've been feeling, you mention fatigue, weight changes, sleep issues, stress. You ask your questions, you watch things, or you catch things early. That's the expectation. But that's not how it actually works. In an insurance-based system, the annual physical is a very specific billing code with very strict rules. And here's the part patients don't know. The moment you bring up a concern, anything, fatigue, brain fog, joint pain, mood changes, digestive issues, whatever, that visit is no longer considered a preventative visit and it's no longer free. It's now a problem visit, and suddenly you may get billed. Your insurance company may deny parts of that visit. Your doctor may hesitate to go deeper because it's a preventive visit. Labs are restricted because it's a preventive visit. So the system quietly trains everyone to do the wrong thing, which is patients learn not to talk. Doctors learn not to ask. That is not preventative care. That's avoidance disguised as efficiency. Insurance companies define prevention based on what is cheapest at scale. Age-based checklist, population averages, minimal labs. Sometimes the labs don't even include a basic blood count. That's not because the blood count isn't useful, it's because it's not prioritized by the payer. And that varies from payer to payer. But real prevention doesn't work that way. Real prevention looks at patterns, it looks at trends, it looks at family history, it looks at how you feel. It helps early shifts in metabolism, inflammation, hormones, nutrition status. These things show up before disease is diagnosable. Insurance doesn't like before. Insurance likes diagnosable. Insurance likes billable. Insurance likes coding. So instead of acting early, we wait, we watch, and we recheck until the problem is big enough to qualify for a code. That's not healthcare. That's delayed reaction. Let's be honest about time. In traditional settings, doctors are giving maybe 7 to 15 minutes per patient. That time includes chart review, documentation, orders, compliance, checking the boxes, billing. There is barely time left to think, let alone educate or connect the dots for our patients. And yet, patients are expected to understand medical language, navigate referrals, interpret their own labs, advocate for themselves. Often while they're sick, they're stressed or overwhelmed. This isn't fair. So we end up with a system that is inefficient, inaccurate, and frankly, unrealistic for achieving the most optimal healthcare. Insurance was originally designed to cover catastrophic events, hospitalizations, surgeries, major illness, things that are pretty expensive. Somewhere along the line, it became the gatekeeper of routine care. And when you insert a third party between a doctor and a patient, you get prior authorizations, denials, formularies, what medications you can and cannot take, non-clinicians deciding what's necessary. That creates defensive medicine, minimal medicine, reactive medicine, not thoughtful medicine. DPC exists because this system doesn't allow doctors to do their jobs properly. It's not concierge medicine, it's not boutique medicine, it's not extra. It's what medicine looks like when you have the time and you remove the middleman. When you remove insurance from routine care, you restore time, autonomy, clinical judgment, which means thinking again, accountability. Medicine becomes a relationship again. In DPC, I have time time. I don't rush complexity. I actually don't avoid complexity. I don't avoid questions. Patients have access. They don't wait weeks to be heard. We intervene early before things ever escalate. Prevention actually becomes preventative. Labs are ordered based on you, not a generic checklist. And most importantly, patients stop being passive recipients. They become active participants in their health. One of the biggest reasons I practice the way I do is because I don't like guessing. Guessing happens when you don't have time to actually talk to your patients. That means you can't order labs that are appropriate for them. You're forced into these rigid pathways. DPC allows data-driven medicine, which I love. It allows trend-based decisions based on the person, not a population. It's precision over probability. This isn't about over-ordering. It's about ordering the proper test for the right person. This isn't about being anti-insurance. Insurance should exist, but it should go back to doing what it was meant to do: cover catastrophic risk. Routine care should not require coding, gymnastics, or gatekeeping. A healthier model is transparent, it's direct, and it's patient-centered. DPC doesn't replace insurance, it fixes what insurance broke. Why this matters for doctors too. Burnout isn't weakness, it's moral injury. Doctors are trained to solve problems. The system prevents that. DPC restores meaning, continuity, pride in practice, and patients feel that immediately. The real question isn't, does my insurance cover this? The better question is this actually helping me stay healthy long term? DPC isn't for everyone, but everyone deserves to understand why the system feels broken and why it doesn't have to stay that way. Because healthcare should be about health, not hoops, billing, codes, not silence, and definitely not waiting until it's bad enough.